This is a short video about evaluating the risk of bias in the included prevalence studies. Together with this video, you should consider the written document Instructions for Tagging and Data Extraction, where you can find more details and examples. As with all risk of bias tools, the assessment requires subjective judgment and it will not always be clear what the risk of bias is. However, using your experience, the written instructions and common sense, you shall be able to tell in most cases whether the risk of bias is high or low. Try to avoid the rating unclear and use it only if there is very little or no information on the topic. First, you are asked to judge whether the sample invited to participate in the study was a true or close representation of the target population. The risk of bias is high when the methods used to identify the participants are likely to produce a sample that is different from the target population in important characteristics such as sex, age, and socioeconomic status. For example, snowball sampling, where participants are asked to recruit further participants themselves, is likely to produce a homogeneous sample non-representative of the general population. When a random sample from the target population was invited to participate in the study, the risk of bias is low. The second risk of bias question is about those people who did not respond to the survey among those invited. We consider as responders those who provided any assessment in the survey, even if they did not complete all the assessments, and we want to judge whether they are representative of the target population. The risk of bias is considered high when the response rate is less than 70%. In case the response rate is higher than 70%, you need to think whether the methods of the study suggest that non-response is likely to be the result of a negative mental health status. For example, people with very serious depression are less likely to fill in questionnaires and return them than people with mild or no depression. If there are strong hints that indicate a significant difference between responders and non-responders in terms of mental health or sex, age, comorbidities, and socioeconomic status, the risk of bias would be judged as high even if the response rate was more than 70%. The final risk of bias question refers to the bias that can be introduced when the instrument used to assess one outcome differs between time points or between subsets of participants in a way that could be associated with their mental health status. So the risk of information bias is high when the instrument or method of assessment is different between time points or across groups of participants. There is one exception to that though. If the groups are formed randomly, the different methods do not generate a risk of bias, and these groups are not formed randomly. If the methods are the same for all time points and participants, the risk of bias is of course also low. Otherwise, the risk of bias is high.